Hi, my name is Trey Turner. I'm a registered nurse and a senior manager of community relations with the Visiting Nurse Association, or VNA. VNA is a home health care company that serves the entire Central Ohio area. VNA is a not-for-profit and also a United Way provider in several of the counties that we serve. VNA does a lot of what you see in traditional home care as far as skilled nursing, physical therapy, occupational therapy, speech therapy, home care aides to provide assistance with bathing and personal care in the home. But what makes VNA unique is that we go into communities and we really try to identify the needs of that community and their residents. And in doing so, we've been able to develop some unique programs that allow us to serve those communities. The first one that I'd like to talk about is our mental health program. We have a team of registered nurses that are mental health nurses that have a background in mental health and mental health related services, and they're Medicare certified, so they're nurses that have had the proper training to go in and work with patients of all different types of diagnosis, as far as they range from schizophrenia, bipolar, to maybe depression and anxiety, which we see in a lot of older adults. Kind of attached to that program, we use our mental health nurses a lot to work with patients with Alzheimer's dementia. It's a specialty program that we offer to patients, but specifically to the caregivers of those patients that suffer with Alzheimer's dementia, that we can go in and work with the caregivers and just do a lot of education and support for them during the stages of Alzheimer's and dementia. Thirdly, VNA offers a palliative care program. We do not provide hospice, but we have a palliative care program that consists of a nurse, several nurses that have a background in hospice. And really what that does is allows us for patients that don't maybe meet the hospice criteria, maybe they're just not ready for hospice, but allows us to go in and start having conversations, start really just answering a lot of questions that they may have, and it provides for a smooth transition into the hospice of their choice at the appropriate time. Another program that VNA has been utilizing that's just been a great resource for our staff and also for our patients is our telehealth telecare monitor. It's about the size of a clock radio, and we install them in a patient's home free of charge to them. We've received grant dollars that allow us to purchase these monitors, and really the goal is just to monitor them on a daily basis, 7 days a week. We can have a monitor in the home that ideally is keeping them in their home and reducing rehospitalizations, which has been the focus of everyone right now, is keeping people out of the hospital. So that's a tool that we have that allows our staff to do that. Lastly, I want to make mention of our social workers. A lot of traditional home health has social workers. VNA, we value our social workers. We have them in all the service area that we covered, full-time social workers that can link our patients with the proper community resources, that can kind of be an extra set of eyes and ears in the home, that can just really try to identify our patients' needs and again, link them with the proper resources in the community. We're blessed in all our service areas to be linked to great organizations like the Area Agency on Aging. We're a passport provider, a levy provider for our service territories, and it just allows us to really just be one organization that can go in, build a trust, be there for our patients, and give them the care that they need in the home. If you'd like more information on the Visiting Nurse Association, you can reach us at 1-877-MY-VNA-OHIO. Again, it's 1-877-MY-VNA-OHIO. Or you can also go to our website. It's www.vnaohio.org. That's www.vnaohio.org.